Immediate management should include which of the following? All right, so we're gonna trying to treat them for something. 17-year-old boy, emergency department. He has sudden onset severe right testicular pain. Started 2 hours ago. He has a right testicle that is swollen, tender, and elevated. Cremasteric reflex is absent. Okay. So administration of antibiotics, manual detorsion, observation and analgesia, scrotal support and ice packs, and then surgical exploration. Okay. So let's see. So this started 2 hours ago. He has a right testicle that's swollen, tender, and elevated. So,
So
all right.
talk to me first.
When
First, the way I'm gonna say this is this question is unfair for step two, or this is more of a step two question. I did sprinkle some of these questions on our bank, right, which upset some people, but just to kind of think you make you think more clinically, of course. But this is definitely not a fair step one question, I would say. So first, always start with what do you think the diagnosis is? Always start with that first.
I think he has testicular torsion.
Bingo. Good. So if this was a step one test, they're probably going to ask you what's the diagnosis. So you got that portion correct, right? So now the question is, what do you want to do now that you got the diagnosis correct? So he has a right testicular torsion.
So, yeah, and I like if it was on the left side, I would be thinking maybe it would be like entrapment or something, like the bag of worms like kind of presentation or whatever, but like he's on the right side, so um let's see. So, well, surgical exploration sounds pretty invasive. I would much rather have somebody like manually try to detorsion or yeah, so that sounds like that. Administration of antibiotics. I don't think he has an infection. This happened 2 hours ago. Observation and analgesia. That sounds like a possibility, I guess, but I'm not sure that like analgesia would like stop the pain, but it's not going to stop the root cause of the problem. Um, Scrotal support and ice packs. Again, that would be kind of treating more symptoms than cause, I think.
Okay,
So
good.
I'm going to go with manual detorsion.
So actually, this is going to be a surgical emergency. Okay, testicular
Oh,
torsion is always a surgical emergency. You want to kind of open it up and try to save because what is testicular torsion? If you were to describe what does that diagnosis mean? Like what is the mechanism how that happens?
I'm not exactly sure the mechanism. My understanding of testicular torsion is we are twisting the testicle
Yeah,
to
yeah,
where
that's
our
what I was trying to ask.
rheumatic cord and vessels get blocked.
Yep, exactly, right. So it twists to a point where it's kind of cutting off its own blood supply, right? Which is not good, right? Meaning that that testicle could die, right? And of course, if a testicle dies, then you become a little bit more infertile as a man, right? And so you want to get in there real fast with surgical exploration to untorsion it. Okay, that's going to give you your best chance. Get to the OR, open it up, right? Either you have to tie it down so it doesn't retorsion, right? But first you have to get the blood supply to the testes back. Antibiotics not great here because it's not, it's not an infection, it's not epididymitis or orchitis, meaning, infection of the testes or the epididymis, right? Manual detorsion can be attempted in cases of suspected, but is not a definitive treatment, should not replace surgical exploration, right? You can try it, but you still need to go to the OR. And the reason why that's the case is because you need a definitive surgery to make sure it doesn't retorsion, anyways, right? Observation and scrotal support are practically the same answer, right? And so on a test, if you have two of the same very similar answer choices, they can't both be right. And like I said, you don't want to just watch this and give them pain meds. You're just masking the issue, right? And that testicle will die, right?
Right.
So good.
Okay.